Hi, welcome to Partially Plastic. We have Carolyn here. She's with Hands of Healing and she does lymphatic drainage. Carolyn, do you want to tell us about yourself?
Hi, sure. Hi, thanks, Kelly, for having me. Thank you for bringing up this topic. It's so important for everyone to be able to get access to the right healthcare. I am an occupational therapist and certified lymphedema therapist. I'm from Wisconsin, and I've been working in the field since '98 in occupational therapy, and I got my certified lymphedema training in 2007.
Oh, wow. So you've been doing this for a long time.
Yes, yes. I work in inpatient rehabs primarily in the past. I worked for a staffing agency and working all over the Milwaukee area. And then recently I started up a private practice working with clients who need help with post-op recovery lymphatic drainage.
Okay. So, like with cosmetic surgeries and stuff like that?
That's correct. Yes.
Excellent. Can you tell us the benefits of the lymphatic drainage when you have a cosmetic surgery?
The great thing about having manual lymphatic drainage after plastic surgery is we can take that swelling and pain down dramatically, and you can get on with your life much more quickly. We can work on things like scar massage and fibrosis, those hard lumps and bumps that people can get. We can reduce those through doing various manual techniques.
Do you think that the compression garment is necessary after that?
I will tell you, compression garments are wonderful. It's a great piece of edema management. We use them for lymphedema treatment. And what that does, and post-op, what that does is it keeps that fluid from going back. And it can help you to for the tissue not to stretch. Because once the tissue stretches with all that swelling, it's going to want to keep going there. So the compression keeps it from expanding too much, stretching too much, coming back. It helps increase the blood flow so that you heal faster. The downside to compression is if they don't fit you right, they can cause more problems. And I think that's a piece that needs more research, is how much compression, the correct fitting, where to get the pieces of the garments that you need. So there's inconsistencies. Some doctors will recommend them, and some doctors say, no, that swelling's normal, it'll go down. So there's no consistency in the practice.
There's not. It seems to be all over the place. One doctor says, yeah, you need it. Another one is like, no, it's fine. So
yeah, or it's the wrong material too. Like it could be too heavy of a material and it's too aggressive and it hurts, and then people won't wear it because it's too tight. And then if it's a tourniquet effect, then that's really bad. So it's important to get the right garment for the surgery you're having. And if you're wearing the faja, one tip is if you can get two, one to wash, one to wear, because they get dirty pretty fast. There's a special one for the Brazilian butt lift that has the cutout in the bottom area. I recommend the compression stockings after any surgery. People tend to kind of lay around, not move. They don't have as much mobility, which they really should have, because it helps promote healing quicker and prevents blood clots. But the compression stockings will help reduce the risk of blood clots and help your circulation.
how long after surgery do you recommend waiting to start the manual lymphatic drainage?
That's another great question. I would recommend 5 to 7 days after the procedure. And especially, I would want the drains to be out if the person has drains.
So you completely wait until the drains are out before you start massages?
Yeah, unless they're for some reason have drains for a couple weeks, that would be unusual. But at that point, I would work around the drains, because what we're doing is we're clearing that fluid away from the area and flowing it back into your system, so your organs filter it out of your body. And that's how you get rid of the extra edema, is by, basically peeing it out.
Okay.
You move it away and it goes back into your bloodstream, and your liver and kidneys filter it out of your body.
Do you recommend people to have massages before they have surgeries?
I absolutely do. A couple days ahead of your surgery will help prime your body so it knows what to do. And then it won't send so much inflammation, but also it really helps reduce that risk of infection after any surgery. I have worked with people that have orthopedic surgeries in the past in inpatient rehabs, and that's where I saw firsthand how powerful the lymphatic massages are for reducing pain and swelling. It's very fast how your body reacts. And yeah, I think the results are fabulous for any post-op, but it really reduces that risk of infection.
Oh, that's amazing.
Mm-hmm.
And your skin looks great. You were telling me that you do some lymphatic massages on your face for anti-aging stuff?
I do, yes. It helps stimulate your collagen. And, I'm in my 50s.
Wow.
And that's all I do. I don't take supplements. I exercise, I take care of myself. I don't smoke. That's a big part of it. You got to drink your water and do your general healthy practice of every day. It's like brushing your teeth, right? But I do that before I exercise. And I can trim off a couple pounds in one workout just by stimulating my lymphatic system and then working out. I had a client last week told me she lost 6 pounds in a day.
No way.
Yeah. Yeah. Oh, well, the lymphatic system is your sewer system, and it reduces inflammation, but also it stimulates weight loss. If you're doing a detox or a weight loss plan, it's a good idea to get regular lymphatic massage to move the fat, because that's how the fat comes out of the cells, goes into the lymphatic vessels, and that's how your body gets rid of it.
Wow, that's amazing. I've never heard of that before.
Sure, yeah.
That's great information.
Yeah, it gets rid of cellulite, wrinkles, makes your skin real healthy.
What kind of credentials should people be looking for when they're looking to have a lymphatic manual drainage?
It's really important to look for a person who has either a certificate in manual lymphatic drainage, and that could be a board certified massage therapist, occupational therapist, sometimes physical therapist, or even a nurse, or a certified lymphedema therapist, which I am, and someone who specializes also in post-op massage, because then they can work on more medical complexities. Let's say somebody had a fat transfer, or they had a reconstructive breast surgery after having gone through cancer. You're going to want somebody who knows those medical diagnoses. Also, you want to make sure they're not going to hurt you, because there are people that think they know what they're doing and they can really cause some problems.
What kind of problems can be caused if somebody doesn't know what they're doing?
Well, if they don't know the risks, like you can move a blood clot if somebody has a blood clot. If they have active cancer, you can spread that. If you're moving the fluid in the wrong place, it can settle there. You got to know how to clear that out just through the techniques they use. You can cause headaches if you're not doing it properly. Those are the main things. So when you got to know how to avoid any open wounds, especially the incisions post-op. I have heard stories of people in other countries doing this opening of incisions and getting fluid out, and that is not something that we do. Okay, that is not in our scope of practice. So please be careful if somebody says they're going to do that. And it should never, ever, ever be painful.
Oh, that's a good sign to look for.
Ever. It is the most relaxing session. If you would go now, Kelly, to go get a lymphatic massage, you'd probably say to me, oh my God, that was the most relaxing treatment I've ever had. Most people fall asleep during it. And it can make you feel energized after and improve sleep. So
A lot of benefits to this. Wow.
yeah.
How long after having the surgery do you think that people should keep getting the drainage done?
That's a great question. I think initially people need to have several, and depending on their surgery's level of complexity and involvement, that will dictate how many they should have. But I think everyone should get one every week later, just as a matter of being healthy, to get rid of that junk that's in our body. It gets stagnant when we don't move around. If we have sedentary jobs, we travel all the time. There's just great health benefits overall.
And is this the kind of thing that you have to drink a lot of water afterwards? Is that important?
It is very important. So the lymph fluid is actually protein, and the other would be more like water, that serous fluid. But our saying is a dry riverbed doesn't flow.
Okay.
But you can think of stagnant lymph as kind of a traffic jam. The roads cause, if there's a traffic jam, there's barricades, the traffic can't go. Lymphatic massage opens that up. When the surgeon cuts through the lymphatic vessels, he's causing those barricades. So we have to stimulate the lymph to flow.
Oh, that's a great analogy.
Mm-hmm.
And I understand that you have a personal story that you wanted to share about why this is important.
Yeah, so if I had known 30 years ago what I know now, I wouldn't have the lumps and bumps from having my cesarean. I had a C-section after having our son, and I ended up with that shelf above my scar, which was a bikini. And then I had a few years later fertility issues, and ended up with having a couple more surgeries. And one was an emergency to remove an ovary, and the doctor couldn't do it laparoscopically. So she did a vertical from my belly button overlapping the bikini scar. So then I had this anchor with like a shelf on each side and above. And there was no recommendations or education on how to reduce swelling or any of that. And that was before any of my training. So I ended up with this disfigurement, and then I ended up having a hysterectomy later, and I ended up better because the doctor felt bad. She said, I gave you a little tummy tuck because I felt bad that I took your figure away from you.
Oh,
So that was nice, but you know, it's an OB/GYN doing it, so I'm sure it's not the level of a plastic surgeon, you know.
and if you would have had
So
lymphatic drainage, how would that have changed the course of that?
I would not have had nearly that level of imperfection because I was pretty disfigured, in my opinion. I would have worn at least the abdominal binder corset and then done the lymphatic drainage. And the reason I know it works is because I was in a car accident a couple years ago and broke my sternum in multiple places. And this is pretty personal, but I was misshapen. One side was way bigger than the other side. And the doctors said, oh, just wear a sports bra. Like, okay, that'll help. I did it myself and it was better in a day.
Oh, that's
Or
awesome.
two. Yeah, a day or two, but they didn't have any suggestions still. And this was just a couple of years ago. So yeah, that's my personal story. And I hope this helps other people get the education for finding what they need for post-op care.
Thank you so much for sharing this with everybody. People don't realize how important it is, and it's just for lack of education, and they don't tell you when you're going to have surgery. There's not a whole lot of pre-op education out there.
No. And I think the problem is that it's so inconsistent. You hear different information so many places and don't know which thing is right for you.
Absolutely.
Yeah. So I'll say if anybody wants to reach me in our community here, because I'm licensed in Wisconsin and I'm located in the Milwaukee area, they can look for my Facebook page or I'm on Instagram too, Hands of Healing LLC. And if they want to direct email me, ask questions, I'm pretty open to giving information out if I know the answer, or if I don't, redirect you to somewhere who can help. That'd be Carolyn at handsofhealing.net.
And that's Carlyn, right?
Carolyn.
Oh, okay. All right.
Yeah.
Well, I'll pin all those to the post also so that people can access that and get to that easier. I thank you so much for your time. I appreciate you giving us all this great information.
Absolutely my pleasure. Thank you so much, Kelly, for having me.